Hey everyone, this is Susan with NRSNG. Today we're going to be working through a care plan on seizures. To see our massive free database of nursing care plans, just visit nrsng.com/nursing care plans. You can also download our free editable PDF care plan template that I'm using on the screen right now at nrsng.com/care plan template. So let's get into the seizure care plan. The first nursing diagnosis that I chose, and there are many that you can choose, but the one that I chose was risk for ineffective airway clearance. Now, when you're writing a nursing care plan, you don't put related to if it's a risk. So risk for ineffective airway clearance would be the nursing diagnosis. I put it's related to and it's as evidenced by because I wanted to help out the thought process and let you guys know what I was thinking. But I put related to neurological function loss and it's evidenced by inability to clear secretions from the airway. So when a patient is seizing, their airway is a major concern. The second nursing diagnosis that I put on is risk for suffocation related to ineffective airway clearance as evidenced by copious amounts of secretions in the airway. And again, like I said, risk for suffocation is not followed by related to or as evidenced by, but I did put that in there. And the last nursing diagnosis I put in is fatigue. This one will have a related to and an as evidenced by, but I put fatigue related to muscle spasms and tension as evidenced by postictal weakness. And this is something you're going to see in most of your seizure patients. They had all these muscle spasms and tension going through their body. Afterwards, the postictal stage, they are fairly weak and fairly out of it. They're very sleepy. A lot of them like to sleep. So as far as patient goals, I wrote a goal for the patient to be able to recognize signs and symptoms of oncoming seizures, and these are also called auras. Some people just have a feeling they know it's coming hours before it happens, or like, oh, I'm going to have a seizure. It can be with sight, sound, any sort of part of your five senses can be off or different. And some people don't know it's coming at all. So if you can educate them to look out for signs and symptoms, and they do have signs and symptoms, that'd be the best way for them to be able to prepare for it. The second goal that I put is educate family and friends on how to care for someone who's having a seizure. You want to make sure that the family knows what to do, such as timing the seizure, making sure that the area is safe, getting them to the floor so they lay down horizontally on their side. Just different things, loosen up clothing if there's anything that's restricting on them. The third goal that I put is to take all prescribed medications as they are prescribed. And I think this is super important for preventing any seizures. But also if, the patient has that aura, they're like, I feel like I'm going to have a seizure, make sure that they're taking their anti-seizure medication, whatever it is that might be prescribed, if it's Ativan or what have you. So for the interventions, for our first intervention of being able to recognize signs and symptoms of oncoming seizures, you as a nurse are going to educate the patient on what auras are. You're going to talk to them about what to look out for and what to do if they feel a seizure coming on. And this kind of leads into the second intervention that you're going to do, which is also educate the patient themselves on what they're going to tell their family and friends. Make sure that the patient knows what the family and friends should be doing. And the things that I listed down here were turn patient on their side, keep an clear airway and make sure that they time the seizure during the seizure. The third intervention is educate the patient on the importance of medicating medication compliance and have them use a dispenser with the days of the week on it. This is the best way to make sure that they have taken their meds instead of being like, I don't remember if I took my meds today. They can look down and say, oh, it's Wednesday and my meds are still in Wednesday, so I have not taken my meds for today. As far as implementation, these are all pretty important and you are going to implement them. So I put yes for all of them. In order to evaluate the outcomes for the first patient goal, I put have the patient tell you their signs and symptoms of an impending seizure and what it looks like and what to look for, such as smells, sounds, tastes, vision, etc. This is the teach back method, and it is by far the number one method that I use in my current nursing practice. I definitely make sure that they repeat back to me what I've said and they can tell me everything, because it has made a major difference. I can tell if the patient is remembering and listening. I know it can be difficult to remember what someone just told you. At the moment, you're like, yeah, I can remember that. But if you have to, it's like some sort of switch in your mental brain to have to repeat it back out. So I use the teach back method and I highly recommend it. For your second evaluation, one of the things you can do is you can check in with the family and friends to confirm that they know what they're looking for. Have them use the teach back method on them as well. Ask them what they were taught, what the family member or the patient told them. And then on the final one, this is a very important one. Repeat back method, again, is the best method to use here. Make sure the patient has a list of all their medications and can tell you what they take, when they take it, why they take it. Those kinds of questions are super important because and have them carry this list on them because it's helps them if they are ever in a situation where they had a seizure or they are not responsive or able to help out. Having this list is important, and it also helps family members know what to do during a time of crisis and what medications that they need to take. So again, seizure care plan, probably the most important thing that we want to look out for is the airway, and then the second most important thing that we want to do for these patients is make sure that they're well educated on how to handle having a seizure, how to prevent having a seizure, and making sure that their family members are involved in all of this.
Visit nrsng.com/nursing care plans for our huge free care plan database, and nrsng.com/care plan template for our editable care plan template PDF. This has been another episode of the NRSNG podcast. Thank you for joining us, and thanks for being a part of the NRSNG family. Now, go out and be your best self today.